Welcome to LivingFuelTV. This is KC Craichy. We're hearing a lot about depression these days, and we're not just talking about the winter blues. Now, everybody knows that if you have depression, you go to your doctor, you give you a pill, and everything will be fine, right? It is not the case. If you were ever to read the package inserts on these drugs that you are taking, or many people are taking, you will see that the side effects of these drugs are the very conditions that you are taking them to treat, and even worse. It is not the answer. You do not have a pharmaceutical drug deficiency. The net of it is there's something missing, typically nutritionally in your life, nutrition, exercise, sleep, all the ones we talk about in our books, but there's something missing that we haven't discovered. And we talk about superfood nutrition, where you can actually mix high quality foods like broccoli, spinach, kale, spirulina, barley grass, blueberry, strawberry, raspberry, cranberry, even eggs. You can take these into your diet and also take supplements, multivitamins and other supplements, so that you can make sure that you're getting all the things together with the things that we don't even know about in the foods. There are things we're discovering all the time, so that you can not be deficient, so that your body can do what it is it knows how to do. If you are deficient, then things happen, like depression, for instance. In a study I just read this morning, it talked about vitamin D levels of patients and depression. And it turned out that the vitamin D levels of patients, when they're over 50 versus under 30, that the ones over 50 had very little depression. Even one in life circumstances like divorce or tragedy and those sort of things, their depression rates were dramatically, quite statistically significantly lower with the higher vitamin D levels than the lower vitamin D levels. Now, we've talked about vitamin D a long time on this show, and we write about it. It's in my books because it is super important, because vitamin D basically is a modulator of your immunity. And so years ago in the early 1900s, they'd tell you if you had depression to go out and get some sun in your eye. Literally, sun through your eye does create a positive, euphoric feeling that offsets the depressive feelings. But in this particular study, vitamin D itself was enough to alleviate the symptoms and the actual condition of depression. So having low vitamin D is not a good idea for cancer, for all kinds of flu and all the other things. So having low vitamin D doesn't make sense to start with. So take vitamin D, spend some time in the sun, and regularly check your vitamin D levels, because over 50 is very important according to most of the experts in the study that study this today. So we also know omega-3, EPA and DHA from fish oil, has a dramatic effect on being antidepressive. So Dr. Stoll, I remember a book that was, he's still in my library today. Dr. Stoll wrote a book called The Omega-3 Connection. He's a Harvard researcher. And he concluded that fish oil was in fact the best antidepressive medication on the market, better than any pharmaceutical, and also best for bipolar. Now that's a more significant version of depression. So this is 15 years ago we've known this. We've known this has been out there. So continuing the pharmaceutical approach, I can't talk you out of it, but I will tell you to do your own research and even add these things to your pharmaceutical approach, and maybe you can drop your pharmaceutical approach at some point. I really hope this is helpful to you. God bless you and have a great day.